I'm going to show you how to scan for the caudal epidural using ultrasound. You could palpate for the caudal space, and then you can put the ultrasound probe on the top of this caudal space. That's another good way to actually get to the structure quickly. So in this image you have seen sacral cornua, the membrane between the two sacral cornua. The whole thick structure is the sacrococcygeal membrane, and this is the anterior part of the sacrum. You can bring the needle out of plane and go through the sacrococcygeal membrane. 9 out of 10 times you will get a loss of resistance or a giveaway, and you can inject the local anesthetic and steroid. Sometimes with the patients who have a high BMI, it might not be possible to see the caudal space in the transverse view, and in those kind of scenario I would recommend you use a longitudinal approach. So here we have now turned the probe longitudinally, and then we'll be looking for the caudal space in the longitudinal approach. So I can see the sacral cornua on one side and then sacral cornua on the other side, and we have a caudal space. So here we have sacral cornua. This is the anterior part of the sacrum, and that's the sacrococcygeal membrane. You can bring the needle in plane, go through the sacrococcygeal membrane, but the tip here is stop at this level because this is a bone that won't allow the ultrasound to chase your needle tip. So once you pass the sacrococcygeal membrane, then you can inject the local anesthetic and steroid. You can perform the injection in two views. You can perform the injection in the longitudinal view. Here we have a longitudinal view. Few tips here: always scan for the caudal space and see how much is the extent of the caudal space. Now here you have medial sacral crest. You have a medial sacral crest here, and this is a median sacral crest, so middle sacral crest. And now we go down, so median sacral crest. Keep going down, and here we have a caudal space. But when I go more distally, you still have a caudal space, but his caudal space is very narrow. Starts here. This is very much obvious, good amount of caudal space, but then ends here. So you have a caudal space which is about 1 centimeter in length, and you can perform an out of plane technique, or you can perform an in plane technique with longitudinal view of the caudal space. And here we have a caudal space with the sacral cornua, anterior part of the sacrum, along with the sacrococcygeal membrane. So we have sacral cornua, anterior part of the sacrum, and this is a sacrococcygeal membrane. You bring the needle in plane, and once you've gone through the sacrococcygeal membrane, you're in the caudal space. Thank you.